Huntington's disease. It is a progressive neurodegenerative, autosomal dominant disorder that damages the brain cells and causes cognitive and behavioral impairment with hyperkinetic movement disorder, chorea. It highly impacts movement, thinking, mood, personality, and speech as well. Accumulation of the toxic proteins in the brain leads to neurological symptoms. Since Huntington's disease affects the brain physiology, it is a serious condition. Due to its heritability, however, as of now, it cannot be prevented or cured, so patients should focus on managing the symptoms associated with it. Huntington's disease, HD, also known as Huntington chorea, is an inherited disorder that affects the brain. It primarily alters the personality, memory capabilities, and mood changes in an individual. George Huntington discovered it in 1872. The disease itself is found in 2% of people in their childhood and 5% of the people who are older than 60. Huntington causes problems with a person's ability to think, behave and move. Gradually, the disease leads to a loss of function, hindering the ability to carry out daily tasks and loss of independence. Huntington's disease typically manifests between the ages of 35 to 45 years, but the early onset can range from 2 to 80 years old. If the condition develops before the age of 20, it is called juvenile Huntington's disease. Juvenile HD progress at a faster rate with greater cognitive decline. Genetics of HD. The Huntington gene, HTT, codes for Huntington protein, HTT, and everyone has 2 copies of the HTT gene and contains a CAG, cytosine adenine guanine, repeat known as trinucleotide repeat. CAG is a genetic code for the amino acid glutamine. A mutation may increase the repeat count and results in a defective gene. When the length of this repeated section reaches its threshold due to a mutation produces mutant Huntington protein, mHTT. mHTT causes pathological changes and increases the decay rate of certain neurons. The HTT protein interacts with over 100 other proteins. Research studies show that mHTT is toxic to brain cells. The early damage is evident in the subcortical basal ganglia, initially in the striatum, but as the disease progresses, affects certain brain regions including the cerebral cortex. The early damage is evident in the subcortical basal ganglia, initially in the striatum, but as the disease progresses, affects certain brain regions including the cerebral cortex. The gene that causes Huntington's disease is dominant, which means that only one mutated gene from either parent is required to produce the disease. The defect occurs when the CAG normal base sequence is repeated several times. The Huntington gene carries instructions to make the Huntington protein. Unfortunately, too many CAG repeats produces toxic form of the protein, known as mutant Huntington protein. Huntington's is increasingly recognized as a disease of the whole brain and body. Areas of the brain responsible for cognition, personality, and movement are particularly affected, leading to the classic triad of symptoms of Huntington's disease. However, it is common for the disease to advance faster in all patients if initial symptoms have appeared early. Mood swings and irritation occur for no discernible reason at first. Affected individuals experience depressed moods and a lack of motivation to do almost anything. Due to the memory loss associated with Huntington's disease, the patient may experience trouble learning new things and performing basic tasks such as driving. Complications of the disease. In severe cases of Huntington's disease, the patient falls more often while walking due to a loss of balance. In the case of advanced Huntington's disease, there can be about 25% loss of brain weight. Neuronal loss in striatal part of basal ganglia underlies the most evident symptoms in affected individuals. Huntington's disease is currently not curable. FDA has approved 2 medications to treat Huntington's disease, which include tetrabenazine, xenazine, and deutetrabenazine, Austedo, to suppress involuntary movements, chorea. Further medications involve antipsychotic drugs, antidepressants, and mood-stabilizing drugs for psychiatric disorders. Psychotherapy, speech therapy, physical therapy, and occupational therapy can significantly improve the quality of life.